Well, I want to thank all of you for joining us today. Of course, want to thank Commissioner Carr for his leadership and for joining us on this teleconference. Commissioner Brendan Carr with the FCC has been doing some great work on behalf of Hoosiers and other Americans. He had an opportunity to visit Indiana not too long ago. It was in conjunction with the launch of My Fair Shot agenda, which we branded as our broader effort to build a ground-up agenda that would serve the unique needs of Hoosiers so that everyone has a fair shot to realize success as they would define success. And we know that one component of this agenda is making sure that Hoosiers can live a healthy and productive life. I've supported funding pursuant to that objective for expanding access to telehealth that's going to really increase access to healthcare services in our rural communities and other underserved communities throughout the state of Indiana. Commissioner Carr, in the course of his previous visit to Indiana, had an opportunity to join me at Hancock Health Center in McCordsville, where we saw a demonstration of telehealth services. And it was really clear through that demonstration that high quality healthcare can be provided through the internet. And this service is going to give an opportunity for more Hoosiers to receive the quality care they need when they need it at lower cost, and ultimately result in better health outcomes so that Hoosiers can enjoy those healthy and productive lives they all hope to enjoy. I was proud to support $200 million in dedicated telehealth funding in the recently passed CARES Act in response to this coronavirus pandemic. I'm also excited, relatedly, that Commissioner Carr's Connected Care pilot program was adopted by the FCC to provide an additional $100 million to support the broader telehealth effort. So on that note, I'll turn it over to the subject matter expert, Commissioner Carr, to discuss this great program that he's developed over the last couple of years, and I'm looking to support in whatever way possible. Commissioner?
Thank you, Senator Young. Really appreciate it, and thank you for your leadership on these issues. I mean, as everyone on this call probably knows, Senator Young is one of the leaders on the Energy and Commerce Committee in the Senate that oversees the telecom infrastructure in this country. And he's been at the forefront of encouraging policies that are going to result in the build out of more internet infrastructure. And that couldn't come at a more important time. Right now, whether it's, Hoosier Jobs, Smart Ag, the internet is going to power so much growth in the economy once we get through this pandemic. And right now, telehealth is going to play a big part in bridging the way there as well. As the Senator mentioned, I was out in the state twice, actually, including that visit that he mentioned in McCordsville to Hancock Health. And one of the things I learned there provided a foundation for this new initiative that we just launched at the FCC. As the Senator mentioned, we are quickly fast-tracking $200 million that Congress appropriated in the CARES Act, and then an additional $100 million for telehealth. I think this is a great example of the Senate and the FCC working together quickly to deliver results that's going to make a difference. So here's what it does, essentially. For years, the FCC has funded and supported internet connections to brick and mortar healthcare facilities. But one of the things I've seen, including on that visit with Senator Young, is there's this new trend in telehealth, which you can call sort of connected care, which is you don't need to go to a brick and mortar facility anymore to receive care in every case. You can have apps right on your smartphone or tablet, video visits with a doctor. And now more than ever with the pandemic, that's so important. We don't want people going to brick and mortar healthcare facilities that don't need the level of care provided there. You can receive quality care right on your phone. And this is also an example of millions of dollars that are being spent that are going to save the healthcare system billions of dollars. We've already seen some pilots out there that are using these connected care technologies, and they're not only improving health outcomes, but they're also saving significant resources. So now is an important time that we move forward quickly, and we're going to be opening up to applications as early as this week potentially for some of this new funding. So we're really excited about the difference that it can make. And it's not just going to be used for treating COVID patients. You could treat everything from heart disease to diabetes. You can get mental health counseling through remote connection. So I think this is a great example of the speed with which the Senate has moved with Senator Young's backing to deliver something that is going to make a difference in the near term in Americans' lives as we get through this pandemic.
If I could just add something before we open up for questions. It's important to recognize that this telehealth initiative, broadly speaking, is very important in the here and now, because to the extent we can provide telehealth services to those requiring them, that frees up additional healthcare capacity, whether it's our workforce or actual space that's available to serve our corona patients when they require it. So the hope is that we can reduce the flow through leveraging telehealth of others that will seek health attention at this time and into the future, because it's unclear, frankly, how long the current pandemic and our dealings with it is going to last.
Yeah, I think that the senator has it exactly right. I mean, one way I describe this to people is to think about it as the healthcare equivalent of shifting from Blockbuster Video to Netflix, right? You don't have to go to a physical facility anymore to get care. You can get it right there on your phone. And as the senator rightly points out, again, we don't want people going to physical facilities that don't need that level of care right now. And that's part of our response. So it frees up resources in hospitals for patients that either have COVID or otherwise need that level of care. And so it's really amazing the speed with which we moved in DC. And part of that is because Senator Young has been helping to lay the groundwork for this for years, including when I was with him in 2018 back in Indiana, understanding the key role that telehealth can play, both in terms of economic savings for the healthcare system, but improving and saving lives. So it was a great example of being able to build on what I saw out there with the senator and get this across the finish line very quickly.
And just one more thing, if I could add, the focus on telehealth is very tightly linked to, at least in my mind, the emphasis on providing care to our seniors and frankly, all Americans at home, if they require it or if they desire it. Aging in place and the ability to receive health care in a home setting or a non-traditional setting is something that I've really been emphasizing at the federal level. We need to incentivize through our payments systems, through our regulatory structure, and so forth. But many of the healthcare services that we want to provide in a home setting can't be provided without ensuring we build out broadband and continue to develop our telehealth capacities.
Great. Thank you so much, Senator and Commissioner. We have a few questions coming in, so we'll go ahead and start with Bob Montgomery from WSBT in South Bend. Bob has a question for Commissioner Carr. Is this something you see as a trend for the future, and does this lend for the same level of care as an in-person doctor visit?
Thanks for the question. I definitely think this is a trend to the future, and that's why I think it's important that we support it. As the senator noted, obviously internet connectivity is a key piece of that. We're helping with that at the FCC, but there's a lot of regulatory red tape at other agencies as well, including HHS that the senator has been talking about. And HHS has been really engaged in some quick reforms as well in the last couple of weeks to put compensation for telehealth visits on something that approximates a better parity. I think long-term, that's part of the solution, is have the healthcare system recognize and absorb some of these costs. In many cases, you can get the exact same type of care remotely as in a physical visit. So for instance, high-risk pregnancies, you can have technologies that monitor and track the baby during the mother's pregnancy. You can have everything from skin conditions. You can have video cameras where dermatologists can look at a mole or a skin condition remotely without you having to go into the facility, and you can get that same quality care. Ear, nose, and throat, there's attachments that you can put on connected devices they can see that. So there's a range of specialties, including mental health, that can be addressed just as well virtually as they would be in person. Of course, there's some things, labs and whatnot, that you're going to need to go to a physical condition for. But if we can take care of those things that don't need the expenses of going to a brick and mortar facility remotely, that's a great thing.
And because of the convenience that ultimately one can obtain from telehealth, I actually think in certain respects, this will offer a higher level of care. That is, if you can prevent a situation from aggravating and becoming a much more acute healthcare situation, then you're going to improve patient outcomes and save substantial amounts of money. In fact, there was a telehealth project in the northeastern part of the United States that was implemented and studied rigorously, and it found that for every dollar spent on remote monitoring, we saved $350 in taxpayer dollars. So this is a smart investment, and that's one of the reasons that Commissioner Carr and I have made it a priority.
Our next question comes from Brandon Smith with Indiana Public Broadcasting. We'll start with Commissioner Carr for this one. How exactly will the money from the CARES Act and the pilot program be used? Will it be used for equipment or other purposes? Please explain.
Yeah, great question. So the $200 million that we have fast-tracked for COVID-19 covers a range of different expenses, including devices. So a healthcare provider, those are the entities that are going to apply to the FCC for funding, eligible healthcare providers, and the funding can cover a internet connection to the house that's needed to power a device. So let's say you're a diabetic and you have a blood glucose monitor. That funding can be used to buy the blood glucose monitor device, pay for the connection to that device, as well as additional costs on the healthcare provider in terms of processing the data from a technology perspective. The longer term $100 million covers a slightly fewer set of expenses, focusing there mainly on the connection to the device. And that program is focused on low income Americans and veterans so that, as the senator says, everyone has a fair shot at the opportunity that next gen connectivity can enable.
I like how that rolled off your lips. Everyone has a fair shot. Thank you. We're trying to socialize that.
That's right.
Great. Our next question, we're going to go to Steve Lindell with WLBC. Do you see applications with the telehealth platform to benefit veterans' health care as well?
I do. I'll first address that, and then Commissioner Carr may have some thoughts. But we already know that our veterans can benefit handsomely from investments in telehealth. In fact, the Veterans Health Administration has studied this. They have a remote patient monitoring program, and they found a 25% reduction in days of inpatient care and a roughly 20% reduction in hospital admission as a result of this. So as with so many innovative technologies, the Veterans Health Administration has been a good incubator to prove that this investment makes a lot of sense from a healthcare outcome standpoint and also from a taxpayer cost standpoint.
Great. Our next question is from Bob Montgomery. Question for Senator Young. What are you hearing about a fourth stimulus package? How large will it be, and who is the target of this additional help?
I'm hearing a lot of different things. I've heard everything from Speaker Pelosi's proposal to put forward and soon vote on a very ambitious, large infrastructure package that no doubt will contain many of her other priorities, among them some aspects I would expect of the Green New Deal and some election year priorities that she tried to insert into the CARES Act at a time when people frankly needed some capital to get out the door. So that's one end of the spectrum. The other end of the spectrum is that they don't think a phase 4 package is necessary. I fall somewhere in between, which is, look, we just largest emergency response package in American history to address this economic recovery. And I'm glad we did so. But let's make sure we properly implement that package. We assess whatever gaps are out there in needs. And then once we've done that, we can really get serious about putting together some legislative language, if necessary, to pass a phase 4 package. In the meanwhile, there's some things that can be done at the administrative level under existing legal authorities to respond to people's needs. We've already allocated substantial resources and are prepared to do more if necessary to ensure Americans' healthcare needs are met. But right now, it's just the production and procurement of various things that is the challenge, and that's being handled at the executive level. And we are, as an office, preparing for a potential phase 4 package. We are maintaining a punch list, I call it, of priorities that are important to Americans generally, but Hoosiers more specifically. So to the extent any of your readers or viewers or listeners have those priorities, they should communicate those to our office, and we'll add them to our list.
Great. Well, it looks like those are all the questions we have. So thank you everyone so much for joining, and we will go ahead and wrap things up.
Well, I'm happy to provide a bit of a wrap. I do want to thank Commissioner Carr so much for his leadership and for the time he spent communicating with Hoosiers, learning at the ground level some of our concerns, including 5G implementation in the Indianapolis area, and his focus on telehealth. I look forward to our continued work together, and Hoosiers should know that telehealth implementation and investment will remain a priority of mine because it's a priority of theirs. It will improve health outcomes and save taxpayers a lot of money in the longer run. So thanks so much for this opportunity to all the members of the media and other participants in this teleconference. Thanks again to Commissioner Carr, and I would invite everyone to contact our office if you have follow-up questions, comments, or concerns.